Hi friends, I am Joel John, YouTube blogger. In this video, we are going to see about US medical billing and what are all the payments which we do and what are all the payments which insurance do, all those in detail. So we'll be looking at premium, deductibles, copay, co-insurance, out of pocket maximum, maximum benefit exhausted. We will correlate this and see, and also we will discuss about family deductibles and family out of pocket maximum. Okay, so first, a patient has to take a insurance cover. For that, he has to pay an amount called premium. In US, they pay mostly on monthly or yearly, and some plans are get the payment quarterly as well. So this is short about the premium collection. So premium is the amount the patient pays to cover his future medical expenses through an health insurance. Okay, so once he pays the premium, he gets enrolled, and there will be a date given as effective dates. That effective date is the date from which the coverage starts, and there will be a date called as termination date. There are also lifetime plans which will have caps in terms of visit and the number of dollar value. That we will see later at the end of this video when we discuss about maximum benefit met or maximum benefit exhausted. So first, we have seen about the premium. Now the second one is deductible. What is deductible? So when a person gets enrolled in this insurance, after the effective date starts, whatever the medical expenses he do, which are covered in this plan as per the EOB, that's called as explanation of benefits. So this explains what are all the benefits, that is what are all the illness or the treatments or the diagnosis which are covered as per this plan. When there is medical necessity, this medical necessity is the key condition. So whenever there is a medical necessity and the service is covered within this category mentioned on the explanation of benefits, then the payment will be made by the insurance after paying the deductible. So now, what is deductible? Deductible is a fixed dollar value a patient has to pay after the effective date of his insurance towards his medical, that's covered medical expenses, and after this deductible dollar value is spent by the patient, then the later procedures or the treatments which are covered will be paid by the insurer, that is the insurance company. Okay, so in this deductible there are two types. One is individual deductible and another one is family deductible. So what is individual deductible and what is family deductible? For each individuals on the plan, a certain dollar value will be given as called as individual deductible. So this is the value that person has to pay after getting covered in the insurance, and once this dollar value is paid by that individual, then it's called as deductible met, and after that the insurance company will pay. So now, then what is family? So if there are four members, A, B, C, D, when each family member pays the money towards his individual deductible, that will be added up in the family deductible as well. For example, A pays $1,000, B pays $2,000, C and D haven't paid anything. So now for A and B, the individual deductible, let's say that the individual deductible for all in this plan is $1,000. For these two people, the $1,000 is met, and as these $2,000 and $2,000 goes into the family deductible as well, the family deductible is 3,000, that is also met. Now C has a payment for just $300, that will be paid by the insurance. Even though the C hasn't paid anything towards insurance, as the whole family deductible is met, now the insurance company will start paying. Okay, now after deductible met, insurance company starts paying. Will they pay the whole amount? No. There are two payments which the patient has to do. One is called as copay and another one is called as co-insurance. Copay is a fixed dollar amount which varies based on the treatment or the diagnostic procedure or the surgery the patient undergoes. These will be given on the explanation of benefits on the insurance website. Okay, so they have to go pay that copay corresponding to that particular procedure. Then co-insurance. Co-insurance is a percentage split up. For example, 90% will be paid by the insurance company, 10% will be paid by the insured, that's the patient or the person who has taken the cover, or 80% by the insurance company, 20% by the patient. So this is how the co-insurance works. So when they pay this copay and co-insurance, all these amounts, whatever the patient pays, when that reaches a spending called as out of pocket maximum, when this out of pocket maximum value will be again for individuals as well as the whole family, whatever they spend will be added up. So once they reach this out of pocket maximum dollar value for individuals, that individual no more need to pay the copay and co-insurance. And if the whole for the whole family the out of pocket maximum is met, then there is no need for them to pay the copay and co-insurance. So 100% amount will be paid by the insurance company. So now this is how the maximum out of pocket works. Now the next thing is maximum benefits. So as I told you, there are monthly premium, quarterly, annual, and also lifetime cover. Where it is being capped is number of visits or dollar value. So when each time they visit for a covered service, the visit will be calculated as 1, 2, 3 constantly. And if the plan has maximum number of 20 visits, once the 20 visit is over, the insurance before the termination date itself, the coverage stops, and as the maximum benefit is exhausted. Similarly, for an insurance plan, say the maximum benefit is $50,000 or $75,000. Once that amount is paid by the insurance company for towards the covered insured medical expenses or towards his family coverage, if the maximum benefits is capped for the family, then the insurance coverage stops, and after that the patient has to take a new insurance or go with the secondary or tertiary insurance. So now the question comes, what about primary, secondary and tertiary insurance? In United States insurance, the person can have more than one insurance for health coverage. Maybe even he may have his employer will be covering the employees in insurance, that also will be added up, or the spouse, both of them would be having their companies covered the whole family. So again there are another two insurance. So which insurance pay? This is given by a term defined as coordination of benefits. So what's coordination of benefits? The patient decides which is primary, secondary and tertiary insurance. So like which insurance company should make the payment first, and which insurance company will make the payment second, and which one is the third one. And also there are different types of plans, like health plan, vision plan, dental plan, and behavioral health plan. Like that, there are so many different kind of plans in US. And also we have accident coverage plans. So when they have different types of plan, based on treatment also they can change the coordination of benefit. But initially itself, the patient should call up the insurance company and say that you are going to act as my primary insurer and my secondary insurance will be this company. And similarly, he has to call up the secondary insurance company and update him the coordination of benefits. Similarly, the third one. In most of the cases, the third one will be a pharmaceutical plan, because saving the premium amount, what they do is, for primary and secondary they will have a complete health care. One will be after one is terminated, the secondary will become the primary. For that also the patient has to call up and update the COB again. And pharmaceutical, some of the plans they will reduce the coverage for pharmaceutical bills, and they will take a separate plan for pharmacy alone, pharmacy expenses alone. So that will be more beneficial in terms of premium. So that's how they work in most of the cases. But they can also have a complete healthcare plan, and also there are plans which cover most of the pharmaceutical expenses in the healthcare plan itself. So now they are given this primary, secondary and tertiary for coordination of benefits. So this secondary, some plans also cover the copay and co-insurance of the primary healthcare insurance. That will be mentioned on the explanation of benefits. And also there are secondary insurance which give this copay and co-insurance as reimbursement benefits. So these are the various different types in which they use their health insurance in US. So for people who are on medical billing, or AR calling or AR analyst, for all these people they should have a very good knowledge about this copay, co-insurance and deductibles and explanation of benefits mainly, because whenever they deny a claim or do a partial payment, even when they do a payment for when they send this payment check, they will attach this EOB, which is called as explanation of benefits, or ERA also will be there for some people. That's called as electronic remittance. uh, so these are the documents which you mainly check why this claim is denied, and how can we appeal for this claim, or for AR callers, how can we request the person to take reprocessing. Everything will be decided based on this EOB. Okay friends, and at the end screen you will see my US medical billing complete playlist. Click on that and watch all the videos, because insurance is a wide topic, I cannot cover it on a single video. So you put multiple videos. You can, if you watch all those videos and share my videos with your friends and start discussing about various terms with them, that's when your fluency will improve. And when your fluency is good, when you go for an interview or when you sit on an promotion discussion with your manager, when they ask questions to check your understanding or to check whether if they promote you, you'll be in a position to train your team members on for ongoing process training, and will you be able to clarify their doubts. They mainly look for your confidence, subject knowledge, and your communication skills, how fluent you are in your communication skill. Communication grows when you talk on those topics. So watch my video and discuss with your friends about these topics. That's when your real talent and your real skills will improve. Just by watching alone you cannot improve that. Also share my videos and ask them to subscribe, press the bell symbol, enable all notification, give a thumbs up as a token of appreciation for me, and also share your valuable comments. It's time to say bye, and if I get any job offers regarding this, I will be putting it on the comments and pin it, and also I will put it on my description, so you can always check that, and text to my WhatsApp number, and or send your resume to my WhatsApp number, so that I will be able to help you out on that as well. Okay friends, it's time to say bye. It's your Joel John J signing off from you. Bye.